Welcome to Compassionate Conversations. The goal of our podcast is to explore topics related to serious illness. Ancora Compassionate Care exists to be a supportive presence for life's journey. We can provide care and support wherever a patient may be on their journey with a serious illness. Ancora Compassionate Care began as Hospice of Rockingham County in 1987. While our name changed in late 2023, we are still the local provider the community has always known. We'll always be there because we've always been here. Welcome to this edition of Compassionate Conversations. My name is Lynn Flanagan and I am the CEO at Ancora Compassionate Care. Joining me today is Jeanne Slayton. She is our growth team leader, and Flavel Collins is our director of marketing here at Ancora. Thanks for being here.
Thanks for having us.
Thanks for having us.
Yeah, absolutely. Do y'all remember the old Doobie Brothers song, Taking It to the Streets?
Absolutely.
It's one of my all-time favorites.
100%.
Yes, okay. Well, we have established how old we all are. That's fantastic. But in all seriousness, that's really how I want to view this episode today. So we've used Compassionate Conversations as a wonderful educational tool. But today there's so much that I want us to, some of it we're going to revisit, but I really want us to unpack everything from our name to everything we offer, our star rating, quality metrics, all of those things, but really break it down. What does it mean? And how can people in our service area use that information? So we're going to take it to the streets today. That's what we're going to do. Let's just start off with what we offer. So Jeanne, just give us a high-level overview, all the service lines from Ancora.
Okay, so starting from the top in the original, hospice.
Yeah.
Hospice services are provided for those who have a limited life expectancy. Best guess of a physician, 6 months or less. Right. We do that in our contracted buildings in the county. So if you're in one of the skilled nursing centers or assisted living, group homes, family care homes, all of those places, your own home. Mm-hmm. And then also here in our lovely Gibson house for inpatient respite care and then end-of-life care at Gibson House. Okay. And then we have our serious illness care program. And our serious illness care program is our palliative care program, but it's true palliative care. So it's offered for those folks who have a chronic illness, COPD, congestive heart failure, or cancer diagnosis, but you're still seeking aggressive treatment for those things. You're not quite hospice eligible and could use an extra support. So our nurse practitioners do a fantastic job of meeting patients' needs and supports and what other resources can we get, all to help keep them healthier and out of the hospital. That we actually have in a clinic in the middle of the county now here in Wentworth. It's a beautiful building, and we're able to bring folks in there to meet with our nurse practitioners and then also serve them in the buildings in the county as well. So again, back in the skilled nursing centers and our assisted livings as well. Yeah. Our newest service line that is super exciting is our counseling center. Mm-hmm. And we have licensed clinical social workers that are able to provide mental health resources, services, everything. The best part is they don't have to been served by us, rather. Right. So anybody can go. Our referral partners can go. Our community can go. I can take my kid because teenagers are a thing, right? And it isn't just grief and loss. It is anxiety and it is depression and it is most definitely grief and bereavement and all of those things. True. But it is so much more than that. Mm-hmm. And Rockingham County needed and continues to need as much mental health resources as we can possibly bring in because there really are very few options here. So this gives our county a fantastic option. And it also is located in the middle of the county in Wentworth, in a beautiful, beautiful office that just is so peaceful. Megan does such a great job of seeing folks there, and we can actually support folks that live in Virginia as well with that program.
Yep.
So Megan is licensed to do that in Virginia.
So easily accessible.
100%.
Here in the county. So, okay, thank you for
That's
that.
a lot.
It is. It is tremendous. And so getting ready to make our next point. So we have talked about end-of-life care. We have talked about serious illness care or palliative care. That would be further upstream, obviously, than end-of-life care. Totally separate service line is the counseling center. So we've been here for 37 years, but we started off as Hospice of Rockingham County. So all of those service lines, Flavel, though, help us understand why the rebranding came around. What made us even think about changing that name?
Sure. Well, as you said, 36 years in 2023, we started in 1987. And for 36 years, we had been Hospice of Rockingham County. Mm-hmm. And for probably, at that point, 34 and a half of those years, had only provided hospice, predominantly in Rockingham County.
Right.
But as we had added the serious illness care service line, which is our palliative care, obviously we weren't just hospice anymore. And knowing, looking down the road, not knowing what other service lines we might add, because at that point I don't know that we'd be sitting here we thought we'd be sitting here talking about our new counseling center.
Right.
So we didn't want someone who was interested in, at that point, maybe palliative care. Mm-hmm. But if you looked up providers in Rockingham County, Hospice of Rockingham County was going to come up. Mm-hmm. And we didn't want anyone to go, well, I don't need to call them because they just provide hospice.
Right.
And we have expanded our service area. We do serve into Caswell County, Guilford County, Stokes County. So if maybe your mom lives at Oak Ridge and you needed help for her, if you just looked at Hospice of Rockingham County, you would assume, if you didn't call and ask us, that, well, they can't come to Oak Ridge to take care of my mom.
Right.
So there were several factors at play in knowing that it was time. And that was not anything we entered into lightly. I mean, obviously, after 36 years at that point, we were most definitely a legacy hospice here in Rockingham County.
Right.
So there was a lot of thought, a lot of planning, a lot of work that went into the rebranding process. And that is, something we continue to emphasize to folks, is it was just a rebranding. It was just a renaming.
Right.
We weren't bought by another organization. We didn't merge with another organization. Matter of fact, if you look at our records, we are Hospice of Rockingham County doing business as Ancora Compassionate Care.
Yep. Well, I appreciate that. So bottom line is we never wanted our name to be a barrier to care, no matter what kind of care that we eventually will offer, right? Because our goal, of course, is to meet whatever need our service area brings to us eventually. Right. So, but just want to be really clear, because we are so proud of where we've come from, so proud to be that community-minded, mission-minded, truly came from a grassroots operation, if you will, that was Hospice of Rockingham County and now has grown. Our mission, of course, is to be a supportive presence for life's journey, and now we're doing that across 3 service lines, which is pretty awesome. So we've unpacked the rebranding. We've got all these wonderful things to offer, but let's talk a little bit about the importance of the roots, the importance of being that local provider. I bet there are probably some people listening, Jeanne, that really don't have any idea that there is more than one organization that could offer hospice operating in this county.
Correct. I've actually heard that recently. Someone said, when they said hospice, I thought it was going to be you no matter what. I heard hospice and I said, okay, because I know you. Mm-hmm. And it wasn't.
Yeah.
We fixed that. They are now with us.
Yes.
But there is a misconception that all hospice is hospice, and it doesn't matter, and we all do the same thing, and we're all the same organization and all those things, and that's just simply not true. We are Ancora Compassionate Care, formerly known as Hospice of Rockingham County. We are the hospice in Rockingham County that serves more than Rockingham County, but our staff live in the areas that they serve.
Right.
We have folks that live here in Rockingham County, that have their kids go to school here in Rockingham County. The same in Guilford County. The same in Caswell County. And I think that that's important as well. People also don't realize that they have a choice.
Right.
One of the things that struck me the other day when I was thinking about this is I had to buy a new stove. The day after Thanksgiving.
Oh, my.
There was a lot of angst involved in that because I have a drop-in stove and there's no room and it has to fit this and all of the different things. But we went and did research and we reviewed and we checked into customer service and how long has this organization or this company been around that's making these stoves, all of those things. We do that when we buy cars. We do that when we buy refrigerators or any other major appliances. People don't know that they can do that with healthcare.
With healthcare.
And it's not just your doctor's office reviews on Yelp, although I would say you probably should look at those.
Right.
But Medicare actually helps folks make informed decisions about post-acute care. Skilled nursing centers are on there. Home health agencies. And hospices are on there. So we are very proud to say that Ancora Compassionate Care is the only full-service, nonprofit, 5-star organization in Rockingham County.
Yep.
Serving the folks of this county and Guilford County and our other service areas with exceptional care from exceptional people.
So you make a great point because we all go on and check reviews of whatever product we're getting ready to buy, right? I read the good, I read the bad, I read the ugly of everything. And so you make a good point because people, what would be more important than your own health care or the health care of somebody that you love? So we should be checking those reviews. So with these 5 stars, you know, let's talk a little bit, Flavel, about where that comes from because it truly is a review. Even though the rating comes from Medicare, but where does Medicare pull that from?
Medicare actually pulls information for the star rating directly from surveys from families served by the hospice.
Right.
So while, you know, when we think reviews, sometimes you think, you know, you saw a restaurant review on Yelp and it said the food here was horrible or the food here was fabulous. While if you go to Medicare's website, you won't see written reviews. When you see that star rating, you know that that information, that data, to arrive at that rating came directly from the patients and families that we served or whichever hospice served.
And it's important, I think, for us to emphasize that Medicare requires the same survey for all of the hospices in the country, right? So it truly is comparing apples to apples. So in other words, Ancora doesn't get one survey and one of our competitors gets a different one. Same verbiage, all of that is the same. So there are 24 different categories, if you will, on these surveys that families complete. So it truly is the family's experience of care. So we take all of that very seriously because we use that information, number one, to improve. We're always looking, you know, what can we do better? How can we serve our community even better than we have? So the last fiscal year, or the last 12 months, we had more than, or right at 20 or more of our quality metrics were higher than the national average.
Right.
We also compare ourselves to the state of North Carolina's average. So right now, the latest thing that is on Medicare's website, all of our quality metrics are higher than the state of North Carolina, higher than the national average. I'm going to step back one time. We have one quality metric that tied within the state of North Carolina. But having that 5 stars is important. So I guess we really want to communicate as we're taking this to the streets. We want people to understand that's not just something that Medicare pulled out of the air.
No.
We can tell people all day long, here is all of the different ways we can support you. But the star rating in these surveys are from real people that say, this is how well.
Yeah, they
take
walk
care
the
of
talk.
us. Exactly.
Yeah.
They walk the talk. That's an excellent way to put it. One thing in particular, though, that another quality metric that's a little bit outside the star rating, there is a metric that Medicare measures that's called the hospice visits in the last days of life. Let's talk about that just a little bit and why that's important. So Medicare actually gets this information from their own claims, right? So it's real numbers. It's nothing that Ancora turns into them.
Right.
They're looking at it, measuring it themselves. So it's the percentage of patients who receive visits from a registered nurse or a medical social worker on at least 2 of the last 3 days of life. That's a lot. But we're basically looking at the very end experience that a patient and family are going to have. Mm-hmm. And I'm going to read you some numbers. So the national average for that metric is that would happen. They would get 2 visits from an RN or a social worker in the last 3 days of life, 47.4% of the time.
Wow.
If I'm perfectly honest with you, that's pretty sad.
Yep.
Yeah.
It's not even half.
Yeah.
If you are receiving end-of-life care, whether you're the patient or the caregiver, when are you most likely, I would say, to need the most support?
Right.
Yeah.
And having been in that situation, it's going to be at the very end.
Right. So nationally, not even half. So let's look at North Carolina. So North Carolina, better, but it's still 61.9% of the time.
So still not 2/3.
No.
Right. Okay. Here's Ancora Compassionate Care score. 89.7% of the time, our patients are getting at least 2 visits, RN or social worker, in the last 3 days of life. Compared to the state and the national average, that is knocking it out of the park.
Right.
100%.
But are we going to knock it out of the park at the very end if we're not knocking it out of the park the whole time?
No.
You want to talk a little bit about that?
It's one of the things I actually emphasize when I talk to folks about what that metric means is, one, I remind folks it only gives us credit, so to speak, for the RN or the medical social worker. Our chaplains are making visits.
Yes.
Our hospice aides are making visits. We just don't get credit from Medicare for that.
Right.
So if they actually put all of the disciplines in, we'd be knocking that out of the park at 100% of the time, right? But it does mean that from the very start, our folks have done an exceptional job of getting to know the patient, the family, the needs, and then communicating all of that within all of the different teams that work together to provide care. So our admissions nurse and the social worker on that first visit did a great job connecting, building rapport, earning trust, and getting all of that information down, and then communicating that to the RN case manager, the hospice aide that's going to visit them, the chaplain that's going to come in behind and have another meeting, all of those things, and of course then our on-call staff as well. So that from the very start, we know this patient's baseline, this family's needs, where we are, and we keep up with that as things progress. So that when we start seeing changes, whoever sees those changes feels very comfortable saying to anyone else on the team, hey, something's changing. I think you need to know. Let's come together, all of those things. I noticed one of our aides did that the other day and called in and let the RN case manager know that something's changing.
Yeah.
You know, I saw this patient early this morning and something's changing. So we were able to instantly pick up that RN. The case manager then can shift things and get out there to see that patient and see what's going on. That's the kind of care that I want for my loved ones.
Yep.
That's the kind of care that I want myself, and that's the kind of care that I want us to be giving to our community.
Yep.
And we do.
We do. And so you make a great point that the care is very individualized. You know, we cannot provide what I would call cookie cutter care. We absolutely cannot, because we could have, the two of you could have the same diagnoses, but I'm your nurse. You're going to look, you're going to present differently. You're going to progress through different stages differently, and you're going to have individual needs. It depends on what your support system looks like. It depends on what you need at home. So our team is very skilled at meeting people exactly where they are and then pivoting on a dime when something changes. So I really want the community to know that how we function inside, that is impacting all of these quality scores. So our communication, how often we communicate with one another. So you can rest assured that our team, we're always on the same page, right? And if we're not, we'll help each other adjust. We will help each other adjust. And then go provide the care that that individual patient and family needs. I don't know that you can say that about any other specialty in healthcare that does treat the whole family. And it's a group, but it's also very individualized for that particular group. So something that is very, that we are very, very proud of. So when you said that's the kind of care that you want, that's what you would want for your people. That's what I would want for my people. So now I want us to help our people in this community understand you can choose this kind of care for yourself.
Yes.
So our referrals come from a lot of places, but let's pick one. Hospitals.
Hospital.
Okay.
Okay. So what do people need to know if they are in the hospital and their loved one is facing a terminal diagnosis? Or if it's further upstream and they need palliative care, maybe not quite eligible for hospice. What happens? You're in hospitals all the time. What happens?
So your hospital case managers typically get that, well, it typically starts, actually, let me back up. It'll start with the physician or the hospitalist that's providing the care while you're in the hospital or your loved one's in the hospital. And they will have a conversation with you about hospice or palliative care. I hope they'll have a conversation with you about hospice or palliative care. I can only speak for some of our local hospitals that I am aware of. So then when you're looking at discharge, the case manager is going to provide you with your options for these post-acute care services. So the same goes for home health or anything else. And these are the companies that every hospital does it differently in terms of here's a piece of paper or these are the companies that you can choose from, whatever. So these are the folks that provide the services that you need. Do you have a preference? Most of the time, I will say people just say no, just whoever. The shock, all of the things. It's stressful, it's scary, it's all of the things, right? But you absolutely 100% get to choose. And you should take the time to look at CMS's Compare website or the information that the hospital team is handing you. Sometimes the sheets that they use have some of those metrics and the data points on them. And you can choose. Very simply, you can say, I want Ancora Compassionate Care.
Yep. Awesome. And so that's part of the reason we even do compassionate conversations. Again, back to the education. My hope is that people will hear this and understand before they're in a crisis, and that families will have a conversation. But truly that they can choose the organization that they wish to provide the care.
And I just like don't wait until it's a crisis.
Exactly.
You can call and ask us questions anytime.
Exactly.
Folks self-refer to our services all the time. You do not have to have an order from a physician to call us. You don't have to have an order from a physician to start services. We can take care of all of those things on the back end if we need one. You can call at any point in time and say, I have this going on. Can you help me?
Can you help?
And we will figure out where you fit in all of those things, and or what other resources, all of those things. So you don't have to wait till you're in the hospital. You don't have to wait till your loved one's in the hospital. Call us. Call us now, and we'll help you so that maybe you won't go to the hospital. You don't have to go to the hospital. You can avoid that hospitalization from the start.
Well, and that's a point that sometimes people are surprised that they don't have to have a referral from their doctor, that you can. You know, and it always amazes me every month when we look at our data, how many, we call them personal contact referrals, where people have just picked up the phone. So typically they're familiar with our services. I mean, we've taken care of somebody else in their family, whatever the case may be. But they are my favorite kind, because how much trust do you have to have in an organization just to say exactly what you said? I've got questions. Can you help me with this? Things like that. So let's switch this around, though, a little bit. So we've talked about 5-star rating, we've talked about our care, why people would want that. But what about our referral sources? What about these physician practices, let's say, or, you know, why should they want? You would think it's kind of a no-brainer why you would want 5-star care for your patients, but you're in offices a lot. What would you say to a referral source as to why they should refer to Ancora?
That's kind of a loaded question, because there's so many answers to that. And how much time do we have?
I know, lots of reasons.
I mean, going back to the hospital, having our services on board with folks helps prevent that readmission once they've been in already, when they have the COPD and the CHF and all of that. I hate to say it right this minute. I don't remember what but aren't we like 99%? I think.
On any given year, just to talk in round numbers, we probably in excess of 95% of our patients never have a hospitalization.
Yeah. And that's a huge benefit, right? But having our services gets them 24/7 access to the RN on call. We'll go out and make a visit if we need to in the middle of the night, answer questions in the middle of the night. So it does, and on the weekends. So it does reduce the burden on our physician practices. So their most complex at-risk patients aren't having to call their service all night long, or all weekend, or any of those kinds of things. Also can help reduce the urgent care needs and the fragmented care for those folks. You know, it helps keep them safer and more supported, so that provider, the practitioner there, knows that they're partnering with an organization that has the best interest of their patients. They can also continue to be their attending doc. And there are some organizations that do not work with the community physicians like that. Then they take over care. But we actually ask our community physicians, do you want to stay the attending? Are you willing to certify? All of those questions, so that they can still take care of this person that they've probably taken care of for the majority of their life. A lot of our community physicians. And that's important to them. So all of those things, because our care is so exceptional, and we're providing that level of service at 5 stars, they know that their patients are in the very best hands. We can partner with them to provide that exceptional care.
Absolutely. So let me jump back just a little bit. If let's say somebody doesn't want to pick up the phone and call, talk a little bit about our website. Is there a spot on there where people can contact us and communicate that way?
There is a contact us form, and certainly they can use that if they just have some questions. We ask, if they're truly making a referral at that point, to call us and not use that form, because I don't want us to rely on technology
Right.
failing us in that moment, that someone doesn't get a response that really needed something right then. But if they've got questions, if they want someone to contact them, if they'll just fill out that form in the Contact Us section, someone will get back with them just as quickly as possible. And obviously on the website, there's information about our service lines and things like that. And the address for the website is www.ancoracc.org.
And we're also on social media.
We are. Folks can follow us on Facebook and Instagram, and we have our own YouTube channel, and we're on LinkedIn. So a lot of different places that they can find us there.
Okay. So we have taken it to the streets. So people have a choice. We want people to understand they have a choice so they can truly make an informed decision about their health care or the health care of their loved one, whether they need the counseling center services, serious illness care, or that's our palliative care program, or end-of-life care with hospice, whether hospice at home or here in Gibson House, which is our inpatient unit.
And before we close, I wanted to circle back around. We talked about changing our name and becoming Ancora Compassionate Care. And as I said, there was a lot of thought and planning. But Ancora, for those that wonder what in the world that is actually Latin for the word anchor. But it also gives rise to words that mean support, comfort, things along those lines. So if you think about a healthcare crisis, whether it is something farther upstream for serious illness care, or it is something that may lead to an end-of-life prognosis, that's a big storm. So what does an anchor do? It keeps us in place. It holds us against strong winds and swift currents. And that's what we're here to do, is to help ground folks. Many of us have spiritual anchors and emotional anchors, and those things keep us connected to what's important. They keep us grounded. And that's really what we try to do. We find out what's important. We help folks remain at home where, let's face it, most of us are most grounded. So a lot of symbolism that is behind our anchor and behind Ancora. And we hope that gives folks a sense of strength and comfort when they see that logo and see our name.
Yeah. Well, that's a perfect way to wrap this up, and I appreciate you bringing that in as we bring this to a close. I appreciate both of you being here today. So if you are looking for end-of-life care, serious illness care, or any services from our counseling center, and you want the highest quality care around, when you're looking for 5-star care, please be sure to choose Ancora Compassionate Care.